Good morning.
Good morning, Shankar.
I love the topic you chose today, standing in the gap of access to healthcare. It's very visual. I see a person, a company, and then I see healthcare here, and there's a gap. And you have basically, to be honest, your life's work is filling that gap and building a bridge. And that goes for individuals, goes for companies. It even goes beyond that. It even you take it to an intellectual level where you are a thought leader in that. You have really reached a moment where you touch people, institutions, thought leaders that not necessarily are in a place to get healthcare from you directly, but you open people's minds.
Well,
And yeah, tell me and us about that passion of yours. And of course, we're interested in how people can work with you directly on that.
oh, I'm glad you said that. You you're right. And I feel like maybe part of the reason that I'm doing that is if I've identified some principles that just really resonate with me, and that's the principle of direct care, direct access, direct primary care. So this model is just kind of invigorating for a doctor to practice in because we can feel like we're doing what we went to medical school to do, like sit down with a patient, take our time, connect with them, solve their clinical problems, and help them along that path to health, or managing their chronic conditions. So, but I've had kind of on my mind recently that there's been a lot of our patients that I've realized where they are in this void or this gap of not having access to affordable care, meaning maybe they don't have health insurance, or maybe they work for a company that offers health insurance, but it's too expensive. Or maybe they participate with their employer health plan, but they can't use it, or they don't want to use it because their deductible is so high. So there's the gap. So we
Mm.
have a lot of people that are using direct primary care with our clinic to fill that gap because they pay this small monthly fee, and then they have unlimited access to us through office visits, through text messaging, through our HIPAA compliant secure app, unlimited video visits, and super discounted lab and imaging. So we're providing that care for them. We're in that gap literally. And
Yeah.
so I thought that employers might want to know that if they've identified some of their employees that they're concerned about who didn't sign up for their employer sponsored plan, but they do have chronic conditions, I feel like those employers should know about what we do because we can fill that gap for those people because employers know that their employees are assets to them. They they keep the business going. They want to keep them healthy, right? And that comes from the history of employer sponsored healthcare in our country.
Yeah. And really, if you think about that gap is pain. It is really pain. That's what we're talking about. We're talking about people who cannot manage their diabetes, who cannot manage their chronic conditions,
Mm-hmm.
people who do not have access to healthcare in cases where whatever condition they suffer from, it would be easily managed and maintained, but because there's not this basic access, there's this pain. And I wanted to ask you, what if we want to go into a specific case of pain that you experienced recently from an employer or even from an employee. Can you share a story with us that really where we can show how there's hope with what you do and offer?
Um, so I was in the clinic a couple of weeks ago, and just walking through the hall, and there was another patient checking out, and that patient saw our nurse practitioner here, and so we exchanged greetings, and he said, "I just want to thank you, Dr. Roger, for what you've put together here for us, because if it wasn't for this, I wouldn't have anything." And so he was in here with a condition that he needed some acute care for, and we just got him right in same day and took care of him. I mean, I and just out of the blue.
Yeah,
That's what he's saying, and he was an example of somebody that was employed by a restaurant, so it's not a big business. The restaurant owner bought the memberships for the employees and provided the care. And so there you go. There was a win-win all the way around. So win-win from between the doctor and the patient, win-win with the employer being able to provide affordable health care to their employees,
yeah.
and win-win for this patient. He had access, and that's the most important thing.
Well, I love that example, Dr. Roger, because it talks about a pain that I keep hearing and hearing, and that is the timeliness, the delay that people typically have to endure between realizing they need help and then something as simple as even talking to the admin staff of the medical facility, let alone get an appointment. And you are talking about everything happening within the same day. And that just having that peace of mind is just relieving that pain, that nervosity, that stress, and that is invaluable. I mean, that is so so important, and you can do that. Your
we
staff can do that, offer that.
we do that. That's the nature of the model, and we will, if we ever get to the point where we cannot take care of a patient same day or next day, then we're doing something wrong in the direct primary care model. I told the staff a couple of weeks ago, we need to be careful that uh, we don't um, we don't limit the the access to the clinicians, because they're answering phones and they're helping us with our incoming text messages and whatnot. But if somebody needs an appointment, no, it's up to us as a clinician to engage with them that day, or at least triage them and get them taken care of next day. And we have access to them after hours that way as
Mhm.
well. We'll do what we can through video visits for all of our patients.
There you go. You heard it
Hmm.
firsthand from the doctor. He basically guaranteed you same day or the following day, right? Where do you get that nowadays? I mean, if that is something you want for yourselves or for your employees, please, please reach out to Dr. Roger. You can do it in the comments here or on whatever platform you consume this. Don't hesitate to send a message. Also, I know these days we mentioned it this morning. Everybody, all the employers are really hurting with the cost increases, and something that's a financial pain, right? And we are very aware of that. And quite frankly, by implementing direct primary care into your business, you will save a lot of money. And that is a whole different topic. I don't know how much you want to go into that, Dr. Roger, but let it just be known that we have data to prove that.
Yes, we do, and we'd be happy to share that. We love just I love sharing that data. I love sharing that data. Mhm.
Well, great. Thank you for your time, Dr. Roger. We hit the 10-minute mark here. Are there any final thoughts you want to share today?
Well, no, just if you're an employer, and you have people that are in that gap of healthcare, it's so easy for us to manage someone's hypertension, diabetes, and keep them healthy. And we don't want to let those chronic conditions go unmanaged, because they can damage certain organs, and it's irreparable
Mm,
once it gets past a certain point. So it's so easy for us to manage them, and
yeah.
it's affordable. So we'll stand in the gap. Employers, remember, if you've got folks that are not on your plan, or they're not using it, yeah, look into what we do, and you can provide that for them individually if you need to, or reach out to us and ask us how that works, how that looks.
Yeah.
We'd be happy to share that good info.
And that also goes for employees who watch this right now and who think, man, we should have this in our company. But maybe you are a little bit unsure about how to approach it. Well, guess what? You contact Dr. Roger and his team, and they'll make sure that in a very confidential and respectful way, we find a way to bring that information to your leadership. Okay, we have so many assets, written form, visual, audio, video, so that your leadership can be exposed to that information. That is where it starts. It's all about education. And one of the people that always supports us is David Caballero. He's very happy with DirectMed Clinic. So he says, excellent medical care at DirectMed Clinic really helped me get my health back. There you go. This is live, folks. And we have David Caballero giving you this testimonial. And thank you, David, for always, always supporting us.
Thank you, David. Yes, sir.
Okay, well, have a great rest of your day, everyone, and we'll be back. Dr. Roger is going to be back on this platform, and send us your questions or just keep an eye on the platform.
Very good. Have a
All
great
right,
weekend, everybody.
bye.
Bye bye.